Dr. Miravalli, just be mindful of your microphone. You're coming in and out a little, just a teeny bit.
Oh, okay. I'm gonna try to play with the volume. This is a new room that I'm using, so maybe the Wi-Fi is not as good as before. So please keep me posted.
All right, sounds good.
So let's start with just review of some basic concepts here, and perhaps you're wondering why it's taking so long for scientists to come up with remyelinating therapies. Well, it's not simple. And one of the reasons is because myelin itself is not simple. In the past, we used to think that myelin is just this fatty substance that just simply coats the nerves in the brain, as well as the nerves in the spinal cord and the nerves in the periphery. Well, that is partially true. It is a fatty substance, but it's not simple. Myelin is a very complex substance. As a matter of fact, here in the cartoon, hopefully you can appreciate the fact that there are all these receptors and these channels, and myelin plays a critical role, not only in insulating the nerves, but also in, for example, the electrical transmission. The function of the nerves depends on the myelin. Of course, the thicker the myelin, the faster the transmission of those nerves is going to be. And in the cartoon at the bottom, you can see a neuron that is represented there with this yellow-looking structure with a core center called the nucleus. And then the myelin is these light blue structures that are going to partially coat the axon. And I'm going to point your attention to a cell that we call oligodendrocytes. And we are going to talk a lot about oligodendrocytes today. You perhaps will see acronyms that relates to myelin and remyelination that includes an O. So anytime you see an O in those acronyms, that stands for oligodendrocyte. And that's a cell that produces myelin. So the myelin inside the central nervous system is produced by oligodendrocytes, and the myelin outside of the central nervous system, something we call the peripheral nervous system, is produced by other types of cells. And that's why we don't see that MS patients have demyelination outside of the central nervous system. And conversely, we don't see that patients, let's say, with Guillain-Barré syndrome, which is a peripheral demyelinating disease, they don't have demyelination in the central nervous system. So two different processes, two different types of cells producing a very similar substance. So even though it sounds redundant, by design, it was done in a way to try to avoid if you shut down one system, you shut down the entire system. So that redundancy has it. So going back to myelin, so myelin is complex. So to try to reproduce this is extremely difficult, and it's virtually impossible to do that in a laboratory. So it has to be done by stimulating the cells that produce the myelin. Because there is nothing as perfect as an oligodendrocyte in order to produce such a complex substance. So that's why you cannot chemically produce myelin. In the lab, you have the only way to remyelinate, in a sense, is by promoting the cells that our body has, called oligodendrocytes, to produce myelin. So that's the first point I wanted to clarify, which in a sense explains why it's taking so long to develop remyelinating therapies. The other concept that is important is if you are in an environment of inflammation, like in multiple sclerosis, the pre-existing oligodendrocyte producing cells cannot remyelinate. So once you create inflammation in the brain, all these myelin producing cells that we have, they are unable to remyelinate. So only newly created oligodendrocytes producing cells or cells can remyelinate. So when you, for example, in multiple sclerosis, so we have inflammation in the brain, unfortunately, these cells that actually are precursors for oligodendrocytes, the ones that were pre-existing, they cannot remyelinate, and that's due to the fact that there is inflammation. So that brings us one point that perhaps is important to emphasize, and I will repeat that in future slides. The first step in order to be able to remyelinate in MS is to stop inflammation. Stop inflammation. It's very difficult to remyelinate. And that's why most of these therapies that are trying to promote remyelination, they do so by inducing the development of new myelin-producing cells, also known as oligodendrocyte progenitor or precursor cells, known with this acronym of OPC. So OPCs are the cells, kind of like the baby cells of the myelin-producing cells. So from now on, I'm going to refer to them as OPCs. In your mind, think of them as the baby cell of the adult myelin-producing cells. So basically, in MS, we have to create new baby cells, new OPCs, so they can actually induce and create more myelin. So this is the formula, right? So even though it's complicated, at the end of the day, it's simple. We need to accomplish all three steps in order to remyelinate in MS. So one is to stop demyelination. The other one is to protect the cells that are going to create more myelin. And the third step is to induce myelination or remyelination. So all three steps have to be met in order for myelin to be able to be reproduced. So let's go over each of these steps pretty briefly. And so hopefully to give you a sense of where are we in terms of developing these therapies. Well, in terms of stopping inflammation, we went a long way. And as you know, we have so many wonderful therapies. We have highly effective therapies that are really good at stopping inflammation. And they have different mechanisms, they have different ways by which they do that. For the most part, all of these therapies work outside of the central nervous system. So what they do is they stop inflammation by preventing, for example, the influx of cells into the central nervous system in the case of natalizumab or Tysabri. They do that, for example, by preventing the activation of T cells in the periphery by blocking the B cells, the so-called anti-B cell therapies like ocrelizumab, ofatumumab, or Kesimpta, Ocrevus, and so we have different ways in which we can do that. They're, for the most part, very effective, particularly the newer therapies. Something I want to draw your attention to is something that happened at the beginning of this year in 2024. Now the FDA gave clearance to a company called Kyverna Therapeutics to study a new type of drug. And this is exciting because this is something that up until now we didn't have in MS. It's called CAR T therapy. So basically, think of CAR T therapy as a way to stop B cells, but instead of introducing an antibody that is going to kill B cells, like Ocrevus, for example, this therapy introduces a way to activate your own T cells to go after the B cells. So you're training your own immune system to go after the B cells. And why is that better than an antibody? Well, when we inject antibodies in people like Ocrevus, these molecules don't work inside the brain. They don't work inside the central nervous system because they're large molecules. They don't go through the barrier. With CAR T therapy, what we are doing is we're training your own cells, and your own cells can go into the central system, and they can not only wipe out all the B cells outside of the brain, but also they have the promise to wipe out all the B cells inside the brain. So basically, the way I look at CAR T therapy in MS is it's an anti-B cell therapy still, but because it's a cellular-based therapy, can work outside of the CNS, but also inside of the brain. So very exciting. There is now a phase 2 trial looking at patients. So it's been already tested in humans on a phase 1 trial, and it was safe. And the phase 1 allow us to look at safety, but also dosing. So now we know what dose is going to be tested in a phase 2 trial. The primary site in the US is in Stanford University in California. And we're hoping that if we become part of the trial site, we'll let you know in case anyone is interested in participating, but we are still very early in the process. But keep an eye on this. By the way, Katie, I cannot see the questions if there are any questions on the chat box. So please keep me posted if you see any questions or comments.
Of course, I've only had one come through so far, which is, are there any special dietary considerations that help aid in remyelination?
I love the question, and yes, we have some news for you. So let's go now very quickly because I really want to dive more into the brain health discussion, promote remyelination. I will not go into detail, but just to let you know that there are so many reasons why remyelination could fail. And all of these reasons, all of these steps are being taken into account when designing therapies. So very briefly, in some of the potential targets of myelination or remyelination is this monoclonal antibody that doesn't have an attractive name yet. So it's known as a recombinant IgM22 antibody. What it does basically, this is a monoclonal antibody that binds to the cells that produce myelin and help them become more mature. So it goes into the baby cells and help them get mature into myelin producing cells. So it's been already tested in phase 1 clinical trial, and we are hoping it's going to be rolled into larger clinical trials as well. This one is interesting, and I'm very hopeful for that. Is clemastine, is the good old antihistamine. This medication is already available. It's already approved as an antihistamine for allergies. It's in the family of Benadryl. It's relatively inexpensive, and that's why we are all like very interested about this. It's been randomly assigned in one of those high throughput clinical studies looking at, let's see if all of these medications are already approved for something else, if we can repurpose them to a different function. And of all of these candidates, clemastine was the strongest one. So the mechanism is not clear, but apparently clemastine in animal models allow these baby myelin producing cells to differentiate into adult myelin producing cells. So it helps in that process of differentiation, very similar to the antibody that I mentioned before. This is oral, and the studies are looking at a high dose. So it's a dose of 8 milligrams daily. Which is pretty high. Usually for the use of, let's say, allergies or seasonal allergies, clemastine is usually 2 milligrams daily. So this is like 4 times the dose that is usually used. The only concern that I have is that, like many of these antihistamines, it can cause drowsiness, it can cause fatigue, and that apparently is one of the most common side effects that is being seen so far. So I don't think we are ready to say every patient should take this. We want to make sure that we understand the benefits. There was already a phase 2 clinical trial looking at patients with an acute optic neuritis and actually helped improve remyelination. So that this is going to be reevaluated now as a long-term clinical trial, and hopefully we have the results soon. Another repurposed medication is this thyroid hormone called liothyronine. And very similarly, was studied as of this random selection of a library of pre-approved medications for other indications, and appears to be a reasonable candidate, again, to help maturate these oligodendrocyte cells. So now there is already a phase 1b clinical study, and we hope it's going to roll into a phase 2 relatively quickly. These early phase 1 studies are mostly to understand dose, frequency, as well as regimen and safety. So I think the exciting part will come when it start rolling into a phase 2 or phase 3 clinical trial. To the question that was posted before, can we do anything outside of medications? And the answer is yes. Not surprisingly, exercise is one of those things that perhaps have the strongest data for remyelination. And I just want to show you something. So in the cartoon that I have here on the right-hand side, So if you look closely in between those vertical lines, these are the oligodendrocytes, right? So those are the cells that produce myelin. And you can see that in a situation of sedentary lifestyle, so patients not exercising, you can see that the number and the connections of these oligodendrocyte producing cells is lower than in the case of patients that are active and exercising. So this was the first study that actually showed in animal models, when you look at in vitro studies, how exercise can change the molecular structure of myelin by inducing the differentiation of these oligodendrocytes into mature forms, something known as oligogenesis. So this was very exciting back in the day, and now there have been a variety of clinical studies looking at human data on how exercise can promote all sort of areas related to myelination. Exercise has been seen as improving the recruitment of these baby cells, the OPCs. The exercise has been seen as helping these oligodendrocytes get to the area that they need to myelinate. Also, it's been linked to increase of these growth factors that we need in order for the axons to become healthier. Exercise has been linked also with improvement on cortical functions, attention, processing speed, memory, but also things like brain plasticity and neurogenesis, so the creation of new neurons, particularly in the hippocampus and in the prefrontal cortex. So what I'm trying to say is that no matter what you look, the use of regular routine exercise, and we have a lot of data in terms of how much and how little, how many minutes, but the message is if you do a routine of exercise, you're going to get the benefits. So there's something, even though we don't have approved medications for remyelination, I want to just draw your attention to the fact that exercise can do a lot for you. In regards to diet, uh, the data that we have in diet in multiple sclerosis is the strongest in two types of diet. One is called the MIND diet, M-I-N-D, which the MIND diet was developed and tested at Rush. And I'm going to introduce you in a minute, but Kathy is going to also talk to us a little bit about some exciting news that we have to introduce the creators and the developers of the diet into our programs. But the other diet also that we have a lot of data is the Mediterranean diet. The MIND diet and the Mediterranean diet are very similar. They share a lot of similarities. I think the MIND diet tends to be a little bit easier to follow and also incorporates low sodium as a way to also decrease some of that toxicity. So in terms of remyelination, we don't have a lot of data on diet directly affecting remyelination, but we do have a lot of data on diet helping with inflammation or decreasing inflammation, as well as some data on neuroprotection, which are also key steps in remyelination. So, and very few comments about neuroprotection, clinical trials in MS. So we talked about there are 3 steps to promote myelination. One is stop inflammation, the other one is enhance myelination, and the third one is protect the oligodendrocytes, also known as neuroprotection. Many medications have been tested. The ones that had some positive results are listed here in the first column. Simvastatin is one medication that also is being in the use of MS. It's been a lot of interest in the use of statins in for decades now. And some studies showed some promising results. Long story short, the studies that were looking at things like relapse rate reduction or inflammation relations to the brain didn't show any significant benefits. However, there was one study looking at patients with secondary progressive sclerosis, and they used this high dose of simvastatin, which is 80 milligrams of simvastatin daily. And of course, they didn't see much in terms of reduction of relapses or lesions, but there was a hint on reduction on brain atrophy. So when you look at, for example, patients that received simvastatin versus patients that received placebo, there was a 43% reduction in the amount of brain volume loss that was seen. So it's a little bit of a confusing study because patients also were allowed to continue on their disease-modifying therapy. So cimatabine was not the only intervention used, so there might be a little bit of a confounder, but more data hopefully will be released in 2025, which is what we expect that the study will give us all the data from all these patients. So just to finalize this first portion of the talk, some promising medications in the horizon. Interestingly, perhaps the ones that has the most promise are repurposed drugs from other indications, medications that are already available. We are not in prime time to recommend them, just simply because we don't have all the data that we want to. But if they do show some benefits, the exciting part of that is that they are already available, they are inexpensive, and they could hopefully be safely used in combination with medications available. So something to stay tuned. Of course, we will continue to update you through this or other ways. But in the meantime, you can do a lot of things today. And as you probably know, I'm a big proponent of a holistic approach, right? So in medication alone is not going to do everything we want. So hopefully, the message is loud and clear that medications are good and they bring some benefit, but also what we do with our brain, what we do with our life, what we eat, the exercise we do, how we live our life also will impact our brain health. So with that, I would like to introduce you to a new member of the team. We are very pleased to welcome Kathy Kiefer. Kathy comes to us from the Brain Health Center of the Rockies, where she serves as the president. And we've been working together now for the last 5 years to help patients, mostly with MS, but also other neurological disorders, accomplish brain health through personalized education. And Kathy is joining us as the Brain Health Program Manager. So Kathy, would you like to say something?
Yeah, absolutely. Well, thank you, Augusto. To it to just piggyback off of what Dr. Miravalle said, I have been running a multiple sclerosis brain health program for 5+ years at this point. We funded the Brain Health Center of the Rockies in 2019. I'm a co-founder along with Dr. Augusto Miravalle. And the program has morphed into various formats over the year and has ultimately changed through conversations with patients. And I think we are at a stage where I am confident in what we provide in this multidisciplinary space. I think ultimately it's been such an honor to be involved in this format. The main focus and passion for my work all along has been looking at patient care more from a personalized approach. So in our MS brain health programs, I do keep our format to small groups, simply to allow for greater discussion, for you to really meet the specialists out there, to have all of your questions answered, and for there to be open dialogue. So for there to ultimately be that comfort between us who are hosting, the instructors and the specialists, but you as a patient are the focal point. So throughout our programs, as Dr. Miravalle said, we've been working together on developing these brain health programs for patients over the last several years. I also have run a Parkinson's disease brain health program, but the MS brain health program has always been our foundation and has been a real passion of both of us. As part of what we do, that we want to bring things full circle. It's important for you to truly understand everything that is involved in your care, to understand the disease state. And so the improve healthcare literacy is a main pillar that we hope that through going through the program that you truly gain as much understanding so you feel confident in advocating for yourself, and that you are comfortable in taking the right steps for your best quality of living. So these are kind of the 3 bullet points that we have outlined: improving healthcare literacy, improving healthcare outcomes, and innovative research programs. So making sure ultimately we're up to date on the latest data and research that is being conducted. And after just listening to the presentation that Dr. Miravalle gave, it's always fascinating for me to see over the last several years how much progress is being made, and it's incredibly exciting. So always love getting these updates from Dr. Miravalle as well. But here's kind of a framework under which we operate. So at the core is brain health. As I mentioned, the various pillars are this multidisciplinary approach that we take. So we don't only want to talk about the disease state and disease modifying therapies. We want to make sure that you are aware of the other factors that truly impact your overall care, which include things like nutrition, and as Dr. Miravalle had stated, exercise and your overall physical wellness. Big, items that always are part of the discussion is cognition, anxiety, depression, sleep. So let's take a real close look at your overall symptoms, and let's delve into that a little bit further. We do add in, of course, a little bit of fun as well, which would be not highlighted here, but would be our music therapy session, a simple, beautiful way to integrate brain health into your day-to-day life. So one aspect not mentioned there, but these are really the core pillars that we try to focus on. Gustav, thank you.
Yeah, I can take it from here. Thank you, Kathy. So basically, the brain health program at Rush has, as Kathy mentioned, 3 pillars, right? Education, which is what Kathy is helping us to move forward, but also a brain health clinic that's already happening at Rush. It's being led by Adrian Castillo, and that's a space for patients to have a personalized one-on-one visit with a provider to discuss and do an in-depth analysis of all of the pillars that Kathy mentioned before that relates to brain health. And last but not least, underpinning of all of these, we have a research program. This is something that we are starting to develop. I will dive more into details during our next session in February. We have 2 exciting news to share with you. One is the approval by Rush of a software for MRI called icometrics that will allow us to have quantitative brain volume analysis, lesion volume analysis in every MRI done at Rush at no additional cost. And that also will not only help us on a day-to-day basis to understand how the MRIs are looking from a disease standpoint, but also from a research tool to allow us to understand how these interventions may be impacting those outcomes. But today we're going to talk a little bit more about the MS Brain Health Education Program. That is the area that Kathy was mentioning before, and that she's going to help us manage. So Kathy, maybe you can walk us through how that 3-week program looks like.
Absolutely. So as Dr. Miravalle stated, it is a 3-week program during which we meet for 6 live web sessions, broken out for you to meet with the various specialists. This format that you see right now on the screen is ultimately, there's some tweaks and modifications as we are moving along, but in essence, all of these topics are exactly what we cover during those 3 weeks. So we've taken, and I'm not certain if it's one of the next slides, but we've taken a slightly different approach to our educational programs, which, yes, thank you, is this flipped classroom model. So ultimately, there are pre-recorded videos with various specialists throughout the country who you can log in, access those videos, and then they match up with each of the 6 sessions that we meet. So these are, again, examples of some of the topics that we cover. I had mentioned most of those earlier, but there are, like I said, there are pre-recorded videos that you watch beforehand. Then we meet for the live sessions to really highlight the most important points, debrief, and open for Q&A. So there's always a little bit of upfront homework that is expected from our students, and I'm very strict in that sense, but no, I'm just kidding. So,
and as Kathy mentioned, we've been running these programs now for the last 4 or 5 years through the Brain Health Center in Rockies, and we are bringing now these to Rush. So in the process of integration with Rush, it's going to be some change, but we hope that it's going to be all improvements. Most of the speakers are going to be Rush providers, or at least providers in the Chicago area, which that serves 2 purposes. One is not only you're going to be exposed to leaders in the area of physical therapy and exercise and nutrition, but also if you would like to follow your care with any of them as part of this multidisciplinary approach, then already you have established some degree of contact, and we can help facilitate that connection. These 3-week brain health programs are going to be absolutely free of cost. There is no charge to any of these. This is just another service that we provide. As Kathy mentioned, those are live but virtual sessions. So there are going to be 6 sessions in a matter of 3 weeks. We try to keep those groups as a small group, around 20 patients. We also invite spouses and family members and caregivers to participate, because we found over the years that, the more people we bring to the table, the richer these conversations become. And sometimes listening to other patients' questions may inspire you to think about things that perhaps you never thought before. So this small group approach, it's been very successful for us. So this is some of the outcomes that we collected over the last 5 years. And you can see that, this is already outdated. So there are over 500 patients now that completed these programs. But at the time this was studied, 97% of patients felt more confident in discussing MS-related concepts. And also 94% of patients felt at the end of these programs that they could make more an educated decision. We presented this data in national meetings, and I want to draw your attention in the improvements. So in figure 1 at the bottom, you can see health literacy, which is ultimately what we hope patients accomplish here, being able to make educated decisions, to improve your knowledge, to understand concepts, for example, brain reserve, to understand the difference between MS progressing versus deconditioning, which is such a critical aspect, right? If you feel that you're feeling worse, is that because MS is progressing, or is it because perhaps you're deconditioning? So you can see that at the end of this program, most patients, and that's why you don't see light blue bars, because it was 0 at the end. They improved, everyone improved in making educated decisions, overall knowledge in MS, knowledge of brain reserve, and overall brain health. So we're hoping to bring these programs here. The first one now, registration is open for 2024. The first program is going to be at the end of January and February. And we'll do 1 winter program, 1 spring program, 1 program in the summer, and 1 program in the fall. So everyone is invited to participate. If you want more information, we're still working on ways to offer you ways to register. In the meantime, feel free to send a quick email to Kathy, and that's her email address right there, and she will walk you through the steps where to get registered. Kathy, anything else?
No, I think this is excellent. And I welcome anybody in particular that might be interested in this upcoming winter program. So as you can see, January, February, we're literally right at that point. So I am currently recruiting for that particular program that starts January 30th. All of the sessions run on Tuesday and Thursday evenings. So for folks there in the Chicago area, that would be from 6 to 7 p.m. that we run those sessions. So again, anybody interested in that winter program, please do reach out to me and we can, I'm more than happy to get you enrolled. I currently have about half of the program filled for that winter program. So not a ton of spaces, but would love to hear from you. And if I can't get you in for the winter, I will most definitely get you into one of our other programs within the year.
Excellent. And
Look
this
forward
is
to hearing from folks.
This is one of the many offerings that we're working on. Of course, the monthly webinars that you're attending now, those will continue, and we'll try to reach a broader audience there. We'll give you snippets of a small version of the 3-week comprehensive program during these monthly webinars. Those are ways for us to give you updates, to answer live questions. We are also working on live events, and we are hoping to target nutrition as the first one for the spring. We are getting some ideas. So if you have ideas or things that you would like us to do, send us an email, communicate with Kathy, and we'll work on that. I mean, at the end of the day, we want to serve your needs. We want to provide a service to you. So we are all ears, and we're here to help. So thank you, Kathy, and welcome to the team.
Thank you. It's an honor.
Excellent. Very good. And as promised before, and this was supposed to be covered by Adrian, so hopefully she can join us in the future, but I'm going to do my best to cover that topic, which has to do with how to manage your New Year's resolution. And I think we all feel excited about a new year, excited about a new period in our lives. So we want to do something with it. And so good ideas fail not because the idea wasn't good, but because the execution was. So it's all about what we do with the idea as opposed to the idea itself. So this is a very well-known framework for setting goals, and it's known as the SMART framework. And this gives us an idea of how those goals should be designed. First of all, a goal has to be specific. Don't be confusing about that, right? So let's say a goal for 2024 will be, I want to exercise, right? So that's very specific. That's easy to understand. It also has to be measurable. It should be something that actually you can have some sort of metric or data to understand if you are getting there. So one way to say, for example, the exercise example will be, for 2024, I want to exercise, 2 hours per week, something that actually you can measure and you can understand if you are getting there or not. It has to be achievable. It has to be something that is within your scope, that you can accomplish. And I always recommend people try not to set goals that are a high bar. Try to go a little bit below that high bar. The reason being, we all want to achieve things. We want to feel that we succeed in something. And sometimes if we set the bar too high, we might get discouraged in a way. So sometimes bringing those goals in a more realistic way allow us to achieve them, and perhaps you might even surpass that goal that you had, and you even feel better about it. So there is something psychologically to not create that bar too high for us, so we can actually accomplish that. The R stands for relevance, and it has to be relevant to what you want to accomplish. In this case, for example, brain health. So it will be wonderful if at the end of this talk you feel inspired to perhaps create a goal for 2024 that is relevant to brain health. And Kathy already mentioned those pillars of brain health, healthcare literacy. Everyone is doing something today. You're improving your knowledge. We are talking about exercise and physical wellness, nutrition, sleep. We are talking about, for example, things like cognitive stimulation and social engagement. For example, disease-modifying therapies and highly effective therapies. So all of those goals are pillars of brain health. So there are different ways you can actually learn more about it, as we mentioned before, the 3-week program, but also you can meet with Adrian on one-on-one, and she can actually talk more in the personal aspects. And the last but not least is perhaps the most important. It has to be time-bound. I function with deadlines. If I don't have a deadline, I just don't get things done. So going back to the example of the exercise, it will be great to say, well, for 2024, I'm going to reach a goal of exercising 2 hours per week. That's measurable, that's specific, that's achievable, that's relevant, because brain exercise is part of brain health. And the time bound, that's going to be by July 2024, I'm going to be exercising 1 hour per week. And by December 2024, I'm going to be exercising 2 hours per week. So that's something that perhaps will include all of these SMART goals. Something else I want to introduce you is a concept that I learned not too long ago, which is known as marginal gains. And this is it's a principle that is very well known in the area of business, for example, but also in sports. And it was introduced in athletics by Sir Dave Braceford. So Dave was the coach for the biking national team in England. And they hired him because there was something interesting happening in England. They had amazing bikers. They were really good individually, but they were not winning medals. So as a team, they struggled to find the formula that will make them improve their performance. So his formula is something known as marginal gains, which says, if you want to go from A to C, and if you want to improve something, you're going to get the most out of that effort if you dissect every aspect of that trajectory and only improve 1% of every component of that area. Let's say that in English, and let's say that in MS language. Let's say you want to improve your brain health. If you try to go from a not so healthy diet to a hyper healthy diet in 2 weeks, you're not going to accomplish everything. However, if you look at every component of brain health and you try to improve by a small increment, by 1% at a time, you're going to get there in a much more efficient and faster way. So basically, we can say, if you look at all of the components of brain health, exercise, nutrition, symptom management, social engagement, disease-modifying therapies, and rather than going from 1 to 100 in a minute, you say, well, by next month, I'm going to, let's say, eliminate salt from my diet. That's all I'm doing. Or decrease salt from my diet. We know that salt is neurotoxic. Or let's say if you smoke, well, by June, I'm going to stop smoking, right? Or if you don't exercise, well, I'm going to start by 10 minutes a week. So 1% increment, but in every aspect of brain health, very likely you're going to get better results than if you just focus on more. And this is what his formula did. You can see that before his appointment as coach, the British Olympic cycling team did not win that many medals. And after he introduced these marginal gains, it changed significantly with the same people. So it's something that is known now as being a very effective way to accomplish better performance when you have an activity that requires multiple factors. So what are the take-home messages from today? Just select the areas of brain health that you want to target. Set some SMART goals. It's important to get a partner or support group. If you have a loved one, if you're married, or if you have someone in your family or a friend, try to engage them into this. It's always good to have someone that is going to check on you, that is going to create these goals for you, will keep you accountable. Sometimes will help you, accomplish things or push you to perhaps limits. Otherwise, if you're alone, you don't do that. Write it down. It's so important to write things down. It's a lot of research showing that if you set a goal, if you just say it to someone, might not happen. But if you write it down and you see it every day, put it in your fridge, very likely it's going to happen. Keep in mind these marginal gains. It's important to improve things one step at a time and in small increments. And last but not least, have fun. Make your goals be something that you enjoy, something that will bring, pleasure to your life. You need to enjoy what you're doing. You like dancing, for example, that's a form of exercise. If you like painting, that's a form of cognitive stimulation. If you like talking, right? Perhaps create a new group, a book club, something that perhaps brings a pleasure to your life that in a sense is related to brain health, but at the same time will keep you engaged. So with that, I'm going to stop sharing my slide deck, and I'll be happy to answer any questions or comments that perhaps came in the chat box.
Dr. Miravalle, I'm not sure if you can see, I'm not sure who can send what to where. So there's a few questions in the Q&A section. So I'm not sure if you can see those or if they're just to me, so I can read some of those off to you if that makes it a little easier.
I cannot. So if you can read them, that would be great.
Okay, perfect. 1 second. And then there's some in the chat that I'll get to in a second. Is AI being used to evaluate other existing drugs like I'm sorry, I'm going to butcher these drug names. Clemestinine might offer treatments to MS.
That's right. So yeah, clemastine was a drug that was, as I mentioned before, repurposed, and the reason why we learned about it was through process of artificial intelligence. These high throughput processes, what they do is that they randomly select thousands of medications and they assign a function and they see which one sticks, and that's how clemastine was determined. But talking about AI, this software analysis that I mentioned before, icometrics, that now is approved by Rush, and we're very proud and very excited. The only center in Chicago to have that, so I'm really proud about it. I apologize, but I'm going to brag about that for the rest of the year because this is so exciting. Will allow us to truly understand what is happening in someone's brain with an MRI. As you know, we currently don't have those tools. And, very often the MRI read says the MRI is stable, and then patients don't feel stable. And we don't have ways to truly understand that. Well, this type of software analysis will allow us to dive a little bit deeper and look at things like brain volume, lesion volume. We know that up to 20% of lesions slowly grow. And unless we have this type of MRIs, measure that. So stay tuned in February, the next session that we'll have in February. Katie, remind me what day is that?
I believe it was Monday, February 12th.
Well, okay. We're going to talk more details about icometrics. We are also going to talk to you about another development called Octave. That's a way that through a blood test, we can measure things like chronic inflammation and things like that. So stay tuned for the next one, but we are working.
Great. So another question. Oop, more questions coming in, and they're all moving my chat down as they come in. Is there any research being done with CRISPR technologies to help correct cells or develop new OPCs?
Yes. So there is an entire line of research that I didn't cover today because it's a little bit far behind. It's called mesenchymal stem cell research. And what that is try to grab cells or stem cells that can potentially become anything and help them differentiate into oligodendrocyte precursor cells. So yes, this is an entire line of research. It's still in the very early stages of research, but that's something that we are all excited about. Hopefully, and to be something.
Let's see.
Dr. Miravalle, you were kind of fading out there at the end, and there was a question particularly around OPC. What is it?
OPC stands for oligodendrocyte precursor cells. So those are the baby cells of the cells that make myelin.
There's another question about what benchmarks are you using to essentially define or determine how good an outcome is for a patient, if that's something you can speak to.
Yeah, for what purpose?
I'm assuming the treatment, or not the treatment, but this was an earlier question back when you were still speaking about remyelination, so I'm assuming it pertained to that portion of.
Okay, so yeah, so that's a great question. So one of the challenges of remyelinating therapies is we don't have good tools, reliable tools to measure remyelination, right? So that's why, most of these studies have been done using, for example, optic neuritis as a clinical outcome, because we could say we can reliably look at myelination of the optic nerve. So there are different ways that we can do that through something called visual evoked responses, or we can also look at things like the thickness of the optic nerve. So optic neuritis trials are more popular when you look at remyelinating therapies, but when you look at the brain itself, it becomes more complex. So some MRI tools allow us to quantify myelin, but those are also kind of unreliable. So that's one of the challenges that we have now in remyelinating therapies also is what outcomes metrics do we use to measure myelination.
There's a few comments just saying you had some great content. There's a couple more comments saying that people would like to sign up for Kathy's next, I guess, cohort of patients that she was just talking about for the 3-week program, which I would encourage everyone to email Kathy directly about that. We will send out the slides probably tomorrow, which has her contact information in it, so you can wait for that. Let's see, and then, a couple more questions pertaining to brain health program. Oh, that's not a question, that's just a comment. What do you think of Wall's protocol?
Yeah, so the Walls protocol has been around for decades, and has some elements that are helpful, but there are also some elements that are actually not based on evidence, and it's extremely difficult to follow. I had so many patients that actually tried to do the Walls protocol and had difficulty following that. So when you look at the more contemporary ways to incorporate diet in a healthy way, both the MIND diet and the Mediterranean diet are easier to follow. They have the components that were originally included on the Walls protocol that have evidence. So the way I look at those is like a modified and improved version of the Walls protocol, and it's also easier to follow. So I don't recommend the Walls diet, not because it's not necessarily helpful. There are some elements that are, but it's so difficult to follow. And there are better diets that perhaps have more evidence and is easier to incorporate in your life.
Great. So I'm going to jump over the chat now. So I'll read them in chronological order. So these first questions will be more about the first half of your talk. What do you think about mesenchymal stem cells versus the hematopoietic stem cell transplant? I said
Yeah,
that right?
great. Yeah, that's great. So that's a great question. So that summarizes the two groups of stem cell research. So the mesenchymal stem cell research, what it does is, as I mentioned briefly before, you select cells, usually epithelial cells from skin or some other tissues. You make them undifferentiated again. So you go back in time, you create the baby version of those. And then from there, you differentiate them back into kind of manipulating cells, going back in time and then pushing back forward. So you can create any cell, you can make them differentiate. Great concept, very, very challenging in MS. I think we are far behind to truly know if you can actually accomplish that, but theoretically it's a great concept. The hematopoietic stem cell research is different. So what that is can we look at bone marrow cells, cells that actually are known to create immune cells? And then can we wipe out all of the immune cells from a patient's body, completely immune suppress that individual, and then reintroduce their own stem cells and create a completely new army of immune cells. Well, that's been done, and that's been done in now phase 3 clinical trials. So we have a lot of data on that. So, and there is conflicting data. So on one hand, clearly it works. So there is some benefit that patients have when you do this type of approaches. It works in suppressing MRI activity. It works in decreasing relapses. It works in decreasing progression. And in some cases, a handful of patients, it also shows that there's some complete remission of the disease in the future. However, as you can imagine, the safety concerns and the logistical complications of completely wiping out someone's system requires a very delicate balance of therapies. So safety is a concern, and the benefits that you get in terms of acute inflammation are not superior to the benefits that we get with highly effective therapies. So for that reason, it's not a strategy that we use commonly in patients. It's only recommended for patients who cannot tolerate any approved medications or they have a refractory type of MS that is not responsive to anything else. I hope I answered that question.
Okie dokie. So we're almost at time, so I think we have time for one last question. Anyone that had more specific questions about the presentation that kind of started rolling in when we did the Q&A, like I said, we will be sending the presentation out tomorrow. And if the slides don't answer your questions directly, you can feel free to email that email address that it's coming from, and I can pass those questions along directly to Dr. Miravalle and the team. But last question, for the 3-week program that Kathy was talking about, is that on-site or virtual? And also, when will the icometrics be up and running and of use to patients on the campus?
Kathy, want to address that?
Absolutely. So it's all virtual. So it's one thing that we have learned over the last several years, that a lot of folks prefer having a virtual aspect for this particular program, just so you can do it from the comfort of your own home. So it is a virtual program. We'll all be hosted by a web.
The sessions are going to be recorded, so you can also watch them again if you want to revisit certain aspects of the sessions. Oh yeah, I see a question from Mike here popping up, and I'm glad Mike asked that question. So I forgot to tell you another good news. Part of this program also includes an app called iCompanion. We are not deploying that yet, but that's coming soon. So through the app, patients can actually, in between visits, input information about things like fatigue or symptoms or pain, and somehow this app will help you quantify these symptoms. So the app is called iCompanion. It's already developed, comes with the icometrics that I mentioned before. It's part of the same package. As soon as we hire our research coordinator, which we are recruiting for that position, that person's role is going to be enrolling patients in the app, help you navigate the app, and kind of educate you on how to use the app to input this type of information. So yes, we have ways now to quantify fatigue, Mike, but hopefully with this app, you will be able to input these symptoms in the app and have a real-time answer of how you're doing in terms of fatigue and other symptoms.
I think that about wraps up the questions, at least from my end that I'm seeing.
Well, thank you, Kathy, for joining us. Thank you, Katie, for hosting this. Thank you, everyone, for your wonderful questions and participation. Stay tuned. As you can tell, we are busy here. We are working a lot, but we are really excited to be able to offer all of these new programs, new developments. And at the end of the day, what we want is to help you be healthier. So just take some time this next weekend that is going to be cold and snowy in Chicago, and perhaps set up some SMART goals for 2024, and we'll see you back in February.
Excellent. Thank you.